of the DSM criteria for each of child and ADHD and adult ADHD. For child ADHD, you need to fulfill 6 symptoms per category. In this inattention category, plus or minus hyperactivity, impulsivity category, means you have to have at least 6 symptoms in this category or both the category to diagnose ADHD in a child. However, for adults, you only need at least 5 symptoms in each category of this. And the duration has to be more or equivalent to 6 months. The age of onset for the childhood onset ADHD, we will take it as less than 12 years old. However, there is also cases whereby we diagnose as adult onset ADHD. So it means that it's not necessary to childhood onset, but that is rare. I mean, most is childhood onset, so we take it less than 12 years old. And it has to be, the symptom has to be noticeable in more than 2 settings. Means that the symptoms as listed here is not only appeared in, say, at home or at work or in school or in social situation. Usually it appeared more than one of this, more than 2 of these settings. Means it's more pervasive. It's not only appear in some situation only. And the impact has to be significant, whereby it will affect the person's social, economic, or occupational functioning. And it should not be accounted for by another mental disorder. Means any of the mental disorder cannot explain the symptoms of such. So first of all, inattentions, there is a few of the points that suggestive of inattention. For example, lack of attention to details, always make careless mistakes, and some will say they have difficulty to sustain their attentions. And somebody, when you talk to them, they doesn't seem like listening. They always distracted, or they couldn't follow through an instruction. They easily sidetrack, and the person might be having difficulty to organize tasks and activities. So this is part of the executive dysfunctions, and they always have difficulty to sustain mental efforts in a very complicated task, especially, and always like students and all will always the parents will always complain that they always misplacing objects. They always have to replace the stationaries for their children. They appear easily distracted, couldn't be focused in their homework, in their assignment tasks, and they always forgetful in the daily activities or appointments. For hyperactivity and impulsivity, this is less significant in adult. However, it still can be observed in some of the adult cases in terms of impulsivity. They tend to be fidgety. In terms, you can observe in their hands and feet is always fidgety, moving, squirming in their seats. Easily leave their seats frequently during meetings or any situation that needs them to sit for long. And running about and feeling restless, this is more of the children, okay? Or excessively loud or noisy, always blurted out answers, talk excessively, couldn't sit still, always on the go, and difficult to wait for his or her turn, and tends to act without thinking. So for adult, I think it can usually exhibit in when during driving. Right, tend to get very restless when they are stuck in the jam, things like that, and tend to make some impulsive actions, like movement during the driving. They may cut the traffic, things like that. Okay, so what is the diagnosis challenges? So the challenges of us diagnose ADHD is because it always mimicking other mental disorder. For example, anxiety disorder, depression, and also bipolar disorder. As we know that anxiety and depression disorder always present with some concentration or attention issues, and they might have some psychomotor agitation as well. So it's very alike ADHD, and as well as bipolar disorder. People with bipolar disorder in either manic or depressive phase, they tend to be distractible, and they might have some impulsivity. Hence, it actually very similar to ADHD. However, as we know that all this anxiety, depression, bipolar is usually episodic, whereby ADHD symptoms is more of pervasive patterns. For the comorbidities, ADHD people always presented with depression, anxiety disorder, substance use disorder due to their impulsivity, and also some are actually self-treating their attention issues with substance, and some of them having comorbid with intermittent explosive disorder, and some of them have antisocial personality disorder. So you can see how complicated is this. They might be mimicking another mental disorder. They might actually come together with some mental disorder. So hence it poses as a challenges for diagnosis. And also, some clinician doesn't have adequate awareness regarding adult ADHD. Hence, a lot of case could be underdiagnosed. Okay, next we'll go to the assessment tools. As we know that, history taking itself actually already adequate to make a diagnosis of ADHD. However, I think most of us, we have a very busy clinic, especially in the maybe in the OPD or in the KK setting. I think most of us have a very busy clinic. And if you think that you suspect some of the cases, but you have not much time to ask history, things like that, you can start with a screening by using the assessment tools. So now I'm introducing this very commonly used screening tools for adult ADHD called ASRS, Adult ADHD Self-Report Skill. So it's a tool developed in conjunction with the WHO and the work group on adult ADHD. The questions are consistent with the DSM-4 criteria. So it's a version lower than the latest DSM-5, as this tool was created earlier. This is a screening tool. We have to bear in mind this is just a screening tool and should always be used alongside with clinical interview for a comprehensive assessment. So we cannot fully rely on these tools to diagnose. So you can use as a screening tool. If it's suggestive, then we might proceed for more history, or you refer to a specialist, to a doctor who can diagnose the ADHD. So later on I will show the assessment tools. ASRS, it uses a total score of more or equal to 4 on the 6 items of Part A section as a threshold to indicate a positive screening test. So as you can see from the screen, this is the this is the ASRS screening tool that I mentioned. It consists of Part A and Part B. Okay, so as you can see, this is Part A. Part A consists of 6 questions, and Part B is consists of 11 questions. But the core question will be in the Part A, because any of 4 or more than 4 questions, okay, which patients tick in the shaded area, means among these 6 questions, if any 4 of this question is tick on the shaded box, so it would count it as a positive result, means the patient is suggestive of ADHD. Okay, so from there you can already get an idea. However, the next few questions in the part B is a supplemental questions, where if you want to have a more detailed history about the patient, you can ask the patient to complete all of these questions. So this is a full version of ASRS. However, you can actually use the shorter version of ASRS. It's called ASRS 6. This is a shorter form of full version of ASRS. It's actually only one part of this full version of ASRS. As you can see, it's a similar questions. Okay, because these 6 questions in part A already enough to give you an idea. Okay, so the message is you can either use a full version to get more idea of whether patient is ADHD, or else you want to be fast. So this is enough for you to have a rough idea that patient might have ADHD. Then you might need to have more history from the patient and the informants. So next, I will go to evidence-based treatment approaches. So I will explain in the subsequent slide one by one. I will categorize it into pharmacological, non-pharmacological, and the last, which is combination of the both. For pharmacological treatment, there is 3 categories of medications that could be used and evidence-based to treat adult ADHD. However, stimulant is the first line for adult ADHD treatment, and according to the evidence-based data, actually amphetamine and methylphenidate is the 2 main group of medication which is evidence to treat ADHD. However, in Malaysia, we doesn't have amphetamine as in our formulary, so we only have methylphenidate. Methylphenidate group of medications, it consists of immediate release and extended release, and also long-acting stimulant. So the one non-quota is the Ritalin immediate release, and the long-acting one is Concerta, and Ritalin LA is also considered extended release. Medikinate acts similarly to Ritalin LA. So actually, each of them have different duration of acting. Like for Ritalin LA, as is immediate acting, it only works for 4 to 6 hours. Hence, you need to prescribe in PD dosing. Whereby Concerta, it actually consists 2 components, which is immediate release and short acting and long acting. The proportion of each is 20% short acting and 80% of long acting. So and whereby Ritalin LA and Medikinate is a bit different. The component of each immediate and extended release and long acting is the proportion is 50-50. So it will depend on the patient's needs and the tolerability when we choose each of these options. Usually I will start with the immediate release, as we want to know whether patient can tolerate methylphenidate or not. If they couldn't tolerate, so I would not proceed to the long acting, because it will cause more of the side effect issues. Like usually the common one, the common side effect will be headache, palpitation, insomnia, appetite suppressions, right? Usually, if mild and tolerable, we will continue. But however, if it persists and very severe, usually I think we would go for another options. So the second option is non-stimulant. So the one available in Malaysia is atomoxetine. in overseas, there's also another type of medication in the SNI group, vilocetin. However, we doesn't have it in our formulary. Atomoxetine is a non-stimulant type of medications for ADHD. So usually we will reserve atomoxetine for those people who have some underlying cardiology problems, such as a very severe arrhythmia, a very severe heart structural abnormalities, hypertrophy. So all these contraindications for stimulant, then we will choose atomoxetine. Or else another group of people that we might opt for non-stimulant is those who are having history of substance use, because by using stimulants there's a risk that they might get into dependence. Okay, so we will usually go for atomoxetine for these two group of patients. Otherwise, there's no other definite contraindication to use stimulants. The last group of medication that we can use is antidepressants. So bear in mind, not all the antidepressant is effective to treat ADHD. Only certain group are evidence. For example, bupropion. As we know, bupropion is a norepinephrine dopamine reuptake inhibitor. So hence is effective in treating ADHD. I will tell you why in a later slide. Okay, so the second medication which is evidence to help with ADHD is the tricyclic group. And for example, the nortriptyline. So this medication is not available in Malaysia. So some of the hospital we have bupropion, but if you have it, so it's another good drug to use. However, if not available, then you can have, usually most of the hospital will have these two options of medications. So next, the graph I'm showing here is a dose-response relationship between catecholamines level and prefrontal cortex ability. So this graph actually showing that I want to bring you to explain about the mechanism of the efficacy for the methylphenidate. As we all know that under normal circumstances, our prefrontal cortex, it regulates our attention, behavior, and emotion. So the function, the deficit of our prefrontal cortex is actually related to our ADHD symptoms, such as impulse control, weak sustained weak sustained attention, and heightened distractibility. Okay, and the chemicals, or we call it a neurotransmitter that is involved in this prefrontal cortex ability is our dopamine and our noradrenaline. This is two key neurotransmitters to regulate the prefrontal functionings. And this graph shows a inverted U relationship between our catecholamines, means the dopamine and noradrenaline, and our prefrontal cortex abilities. In the context of when we are in the fatigue conditions, okay, so the prefrontal cortex abilities is actually affecting by too little of dopamine and noradrenaline. Okay, so this will cause us to be fatigue. When there is a moderate release of catecholamines, so our prefrontal cortex functioning well, hence we will maintain in a optimal alert conditions. However, if the catecholamine is excessive, is overflow in our prefrontal cortex, then the functions will go down again. So in summary, we have to have a moderate level of catecholamine. So this explains why the methylphenidate can work for people in ADHD. Uh, as we have explained earlier, in ADHD, usually people will be in such a situation where they have deficit of the level of both of this catecholamine. So methylphenidate mechanism of action actually is to inhibit the transporter of both norepinephrine and dopamine. And the outcome is that will be increase of level of dopamine and noradrenaline, and hence it will help us to achieve a alert level. So this is the suggestion for the options of medication for each of these special populations. As I mentioned just now, substance use disorder, usually we will opt for atomoxetine to avoid the dependence issues. Whereby for people in depression, we will choose for bupropion because it will help with both depression as is an antidepressant, and it would also help with our ADHD conditions. For people with anxiety disorder, evidence suggests that we combine both the methylphenidate and either SSRI or SNRI. Whereby for people for pregnant women, we will either go for stimulant or atomoxetine. There is no evidence to show that any side effects of this methylphenidates towards pregnant women. So you can choose either one of this. So the next treatment for the other treatment for ADHD will be non-pharmacological treatment, and the most evidence-based non-pharmacological treatment is cognitive behavioral therapy. As we know that CBT actually indicated for a wide range of psychological condition, and it actually evidence-based for people with ADHD as well. And the CBT that we are talking about is actually we are targeting on their executive dysfunctions. The second method that we can use is ADHD behavioral strategies. This is just more of like expert advice towards people having these ADHD conditions. Okay, it can usually conducted by people who are trained in the ADHD coaching. They will tell you, what kind of strategies that you can use actually to help yourself to cope with your ADHD symptoms. And the third will be the specialized support systems. So this, I will bring you through more about this later in the subsequent slides. So first of all, I'll talk about CBT, targeting executive dysfunction. Usually, CBT for ADHD, we will provide around 12 to 15 sessions to impart the skills and strategies to compensate for the deficit in the executive functions or the self-management. And the monitoring has to be done by the ADHD symptom checklist. You can use some checklists, for example, partly deficits in executive function skill. This is actually to monitor the symptoms pre and post treatment, and the input from other informants also important to measure the effect, the efficacy of the CBT. And this is a list of behavioral strategies that we will advise to the patients about how to cope with their inattention, their executive dysfunction, and all this restless, hyperactivity, impulsiveness. So first of all, okay, get organized. As we know that they have difficulty in planning, organize, in time management and all that. So to be organized is very important, okay, and to follow a routine so that they will get into order for the things that they are doing, and hopefully by doing the routine, they will have less forgetfulness, they will get themselves more in track of doing things, and visual reminders, as they tend to be very forgetful. And visual reminders will play a role for them to remind them to for some important tasks and appointments. And the other thing that is important for them to, as we know that they are easily distracted, okay, they're difficult to focus. So the other advice is for them to minimize the distractions. For example, their working table, right? If there is a very messy conditions, things like that, or a lot of gadgets near to their workplace. So this is very actually it plays as a very distractible things for them. So we will advise them to clear up their working table, make your things in order, things like that would actually help. And this is a very important advice for them to split their task into small or even micro tasks. As we know that they have very limited attention span, hence it's very important for them to split it, like say 1 hour task. If they split it into 10 minutes with 5-minute rest in between, or 2-3 minutes rest in between, then another 10 minutes, that will be very helpful for them. And also they need to know their limits and arrange their work appropriately, accordingly, and in order to prevent themselves to act or speak impulsively, they will be trained to give times and to stop and think before they react, and also to find a substitute behavior for their hyperactivity. For example, as we see some people with this ADHD condition, they would either fidgety or turning their pants, things like that, right? When they have to sustain in a situation where they need to stay still and things like that. So in replacement, they would be encouraged to do something else. For example, if you feel that your hands have to do something to calm yourself down, right? So this is ADHD people, and they will say, when I turn my pen, I feel more in place. I will feel more calm, things more calm, things like that. So that's why they're turning their pen. But it doesn't. It's not too functional, because it will display to people that you are restless, and actually sometimes it would actually disturb other people. So we would advise them to, instead of you turning your pens or moving your hands and things like that, you can try to make notes during your lecture, during people briefing, meetings and all that. This is just an example. And another concept that this is a new concept that I'm introducing now is body doubling. So it is a way of coping up for ADHD condition. This is like you are educating people with ADHD to work alongside with another person who can act as a buddy, who can provide passive or active support, and in order to increase their focus and motivations. So it serves that partner, actually serve as a people who can do the activities. Not necessarily the same activities, usually will be the different activities, such as any study, work or house cleaning. Okay, so it can be anyone actually. You can pair with either a people that you know, a friend or family, or even a virtual companion who is there to encourage and accountability and consistency. This is made in a way so that it will reduce your procrastination by creating a sense of sharing and responsibility, and will help to decrease the feeling of you are having the situation alone, right? You are and makes the task more feel less daunting. So in fact, this body doubling is getting more popularity, whereby you can actually find the application in your smartphone for this to do this. Okay. Or else it can be done actually physically. You just you need to complete a task. So you pair with another person, that another person maybe do another task. So you will say to the person that, okay, so this 1 hour we have to complete each other task in this 1 hour. So in this 1 hour, so I must pay my full attentions and avoiding all the distractibility, and in order to complete my task. So that the concept is around there lah. Okay, it's not a very rigid concept. It's just like, you pair with somebody, so that you will have the motivations to complete your task. So for people with ADHD, it's a very it is work to try things to do. And for ADHD coaching, it usually carried out by people who are trained in the ADHD coaching, and the person would provide you with guidance support to achieve your specific goals. They will help you to, if you have difficulty, to break down your tasks, and just now like we mentioned, like break your big tasks to small and things like that. Some people couldn't even plan how can I break my task into small, and these coaches will help you to plan your activities and break down the goals into smaller, actionable micro steps, and help you with the time management and how to overcome procrastination, things like that. Provide structure and individualized support, critical for those who are struggling in planning and follow through. And regular check-in to help to track the progress, to celebrate small wins, and to keep motivation high. So this ADHD coaches is usually among our psychologists who are trained, and also you can find it virtually in the apps, in the mobile apps. The last, I will say this combination of therapy, which is we combine medication plus CBT. So this is a first-line treatment, as evidence shows that this is the most effective approach of therapy for ADHD. So like medication, stimulant is the first line and CBT is the first line. So if both work together, it will be the most effective. So next, I will bring you through two case studies about two clients that I have encountered to let you have a more clearer picture of how the ADHD symptoms, ADHD patients presentations. So first case, she is a 43 years old housewife. She has resigned as a clinical doctor in a specialty in 2018. She complained of low motivation in doing house chores for the past 3 years, where she described as, I feel myself is very lazy. Okay, and since then she becoming full-time, she become full-time housewife, she said she feel very excessively taxing to do all the housework by herself without her husband's help. Then she told me, and when I explore further, she told me that before she resigned, the husband is actually a doctors in another field. When they are both working, the husband will share the housework with her after their work. Okay, but the condition now is after she resigned, her husband refused to help her, as with the reason that she already a full-time housewife, so she has all the responsibility to do all the housework. So she is feeling very overwhelmed by this, and her husband even blamed her for being lazy, and she gradually became depressed, more demotivated, and felt useless with frequent crying spells. She then resigned from KKM after being humiliated by her superior for her incapability of completing tasks assigned to her. Being overwhelmed with the work, mainly due to her poor organization, especially in administration work, since she was promoted as a specialist. Her third son has just diagnosed as ADHD recently. So since then only she started to suspect herself might have ADHD as well. So from my further history, her childhood always being commented as being lazy, unable to complete her homework on time. She always appeared to be daydreaming and frequently misplacing things. During her study in the university, she said she could recall that she always struggled to meet the deadline. However, she able to hyper-focus at the last minute of the deadline. This is a very typical strength that the ADHD person would have. They not only have all the symptoms and weaknesses, they actually have strength as well for most of the ADHD people. They were able to rush into the deadline and complete everything by the last minute. Okay, so around us, if you can notice, few of our colleagues will be like this. They would always drag their things into the last minute. However, they still able to complete, right? So there is some signal already. They might have some of these conditions. And she also difficult to stay focused in reading. Usually, she will learn by listening and learn in the study group. Okay, so I was very curious actually when you said that, since young you has been having this poor focus, couldn't do her work alone by long hours, things like that, right? So how can you proceed with your further study and become a specialist, right? Then she said, even though she couldn't focus in reading, she always learned by a lot of listening. And she has a very good study group in the university. Hence, she can complete her study in the university. Apart from that, she was said to be very careless, always forgetful of her appointments and important dates, and she tend to procrastinate in her work. And she also having difficulty to follow long conversation and movie. So from all the history that she has given to me, I have diagnosed her as ADHD, childhood onset with depression. So I started her with Ritalin short-acting. After I found that she is tolerating well, on the second appointment, I then switched her to Ritalin LA. And I slowly optimized from 20 milligram to 40 milligram OD. And then the Prentilix was also prescribed for depression at the first encounter, but she stopped by herself after a week as she felt better. You know why she felt better after my first appointment? It's not any magic has been done by me or was the Ritalin was so effective or things like that. It's actually because after she was diagnosed, she go back and tell her husband, okay, I was diagnosed with ADHD, and her husband happened to be like understanding at the beginning. He said, okay, so he expressed his understanding towards her, and he agreed to help out with some of her housework, and she felt so relieved after the first encounter with me. And she said that she able, subsequently in the follow-up, she said she able to sustain her attention longer and increase in productivity around 30 to 40% in the next 2 months of appointment. So the effect of the medication, it will take times actually, right? And usually we have to slowly taper into maximum of 80 milligram. The Ritalin LA, you can optimize it to maximum 80 milligram. And she also told me that she started to join some self-enhancement course online. As she is a full-time housewife, she still have to take care of her young children, and also she can only join some online courses, but she feel very motivated, and she even called her housework as some of the project, because she said she recently has a project to be done to tidy up the house, because it appeared to be very messy, and now she finally has gained some motivations and she able to sustain her attention longer. So her project is to tidy up and clean up the whole house. So she do it phase by phase. Okay, however, I didn't, this is the last appointment from her. I'm still optimizing her medications. So hopefully she can progress further. So my next case is 24 years old, female. She's a law student in UK. She's currently in final year. She came to me early this year, around January. She came to me. She said she just back to Malaysia a month ago, and she is currently working as a part-time management trainee in a local college. And she came to me to request a letter to prove her medical condition so that she could defer her exam. The fact is she has failed twice her final exam previously, and this is her last attempt of last attempt of examination. So since then, after that, she will exhausted all her attempt and she will never be a lawyer again. Just like our medical degree, right? I mean, we have a limited attempt. So if you exhausted all, so you will never have opportunities to further, to become a doctor again. So it seems applies to her, and she is very overwhelmed because of that. She desperate for my letter okay, to help to prove that she had to defer her study. And she provide me further history that she has been diagnosed MDD, major depressive disorder, with anxiety, with multiple previous suicide and self-harm attempts, diagnosed back then in 2019. Later on, she was revised to bipolar 2 disorder after a hypomanic episode. In 2022, she was diagnosed as MDD with ADHD. That time she was in UK already, and she was referred to ADHD clinic, but she didn't attend. Apparently in UK, she told me there is a specialized clinic only for ADHD, and it was managed by the nurse. Okay, but she didn't attend. So since then, I started her on Brintilix 10 mg OD. Since then, the doctor then started her on Brintilix 10 mg OD. After the treatment, her depressive symptoms improved, and she has only occasional suicidal ideation when overwhelmed. And her last self-harm attempt is in the mid of 2023, means more than 1 year ago. However, after losing her grandfather and failing exam for twice, in April and August last year, her depressive symptoms become worsened again, whereby she had difficulty concentrating in her reading and she had frequent crying spells. From further questioning, she said her childhood history is not significant in a way that she is not sure, because she never heard from her mother any unusual history about her during the childhood, and she always coming alone. Hence, I'm not able to get any collateral history from any informant. For the onset, okay, she just could recall that she had very short attention span, around 15 to 20 minutes while she was a secondary school student. She easily get distracted, always fidgety, and procrastinate her tasks, misplacing things, and always forget about her task and the deadline. However, she forget when it started. So she's unsure of the onset, whether it's either is before or after 12 years old. So I'm doesn't sure whether it's adult or childhood onset, but it's obviously she has a bipolar 2 disorder, and currently with a new diagnosis of ADHD, query adult onset. She was prescribed with Seroquel XR 50 mg on night and then optimized to 100 mg on night for her bipolar disorder. 6 weeks later, I started her with Ritalin short-acting, Ritalin IR. Then, after she tolerating well, I switched her to Ritalin LA 20 mg OD. After she made up her mind, because at the beginning she told me she don't want to start both medication because she's worried that the effect of the medication, she might have higher chance of getting side effects. So she said, okay, one by one. So after Seroquel, her mood improved. Then she agreed to start Ritalin. Then only I start and I educate her on some behavioral strategies as well. And since the treatment, on my second and third appointment, she told that her low mood has improved. She had less crying spells. And finally, she decided to quit her part-time job in order to fully focus on her study. And this decision is supported by her parents. For your information, earlier that she had requested for the letter to the university to defer the hospital, and after the letter written and sent to the university, it was granted. So she has now another attempt of exam and she feels relief. And she decided to try all out for her exam with the ADHD treatment. And however, because she is still only a few counted in our appointments, so ADHD symptoms report, still the same because she is only 20 mg OD. So I plan to optimize further for her Ritalin dose. So I coming into this final slide of my presentations. Some key takeaways for all. Adult ADHD is a valid and treatable condition. The accurate diagnosis requires a thorough clinical interview assisted with screening tools and a combination of pharmacological management plus cognitive behavioral therapy is a first-line treatment for adult ADHD. With this, I will end my presentations. Thank you for your attentions. If any questions, you can put up in this is my reference. If any questions, you can put up in the message or Slido, as Dr. Nathaniel has informed earlier.
Okay, thank you very much.